So those modalities are still important. So, I mean, this test doesn't replace ultrasound scans. So
Okay.
ultrasounds are still very important part of the risk assessment of the pregnancy and of the baby. And of course, ultrasound can detect certain possible problems in the baby, let's say a heart defect or a problem with the spine or the limbs, which you can't detect necessarily with a genetic test. So there's definitely still a role for having ultrasound. Also very important, an aspect to monitor the growth and the development of the baby. But the non-invasive test has really changed our ability to screen pregnancies quite accurately and very early already in a pregnancy. Because for many years, the only real option for couples who, for example, wanted to know about their risk of having a baby with a genetic condition like Down syndrome would be to have what we call an invasive test like an amniocentesis, where there is a needle introduced into the womb of the pregnant
Which I
woman.
understand is very dangerous.
So it's not very dangerous. If there is a small likelihood or risk of complications, mostly just being a very small risk. Usually we say about 1% or less of having a miscarriage. But of course, that is not a risk that many people want to take. So this is very much a safe alternative to having an amniocentesis. It doesn't completely replace an amniocentesis. It is still the gold standard for diagnosing certain genetic conditions, but the NIPT test allows us to give a highly accurate indication of the risk for the baby. And therefore, the baby does show a high risk for certain genetic conditions. The parents might opt to have an amniocentesis as a follow-on test.
Sure.
But if the baby is low risk, they may choose to rather avoid that kind of test with the small miscarriage risk.
Okay, but now, when it comes to autism, I understand in the previous times, doctors couldn't tell until the child was at least a year and 10, at least a year actually. But now I've heard that it's possible to even detect autism when you're doing genetics tests. So is it possible to do that? And your muscular dystrophies, can you detect that the child might have that through this non-invasive prenatal testing?
So Sibongile, at the moment, this kind of testing is not yet optimized for detecting autism, and I'm not aware of the ability of NIPT to yet detect Duchenne muscle dystrophy. The genetics of autism is quite complex. So there are numerous underlying genetic factors, often also some environmental factors that we don't yet completely understand, that can contribute to the risk for autism. In some cases, it can be accompanied with certain genetic conditions or syndromes. So, of course, if the child has a co-occurring genetic condition or syndrome, we could use genetic testing to detect that underlying condition.
Right.
But not for detecting autism.
So we're looking at your Down syndrome kind of situation.
Yes,
Okay.
yes. So your more common, so chromosomal conditions, these are conditions that are caused by extra or missing chromosomes, which are essentially these packets that contain our genetic information or our DNA. So we usually have 46 of these chromosomes, most people. But in some cases, a baby may be born with an extra chromosome or a missing chromosome. And yes, exactly, that leads to certain genetic conditions like Down syndrome, for example.
Now, in the light of Pregnancy Awareness Week, can you explain the significance of this week and why it's important to raise awareness about prenatal care?
Yeah, so Pregnancy Awareness Week is essentially a awareness campaign that is run every year in February by the Department of Health. This year it is this week, so from the 10th till the 16th of February. And the aim of Pregnancy Awareness Week is essentially to strengthen pregnancy education and highlight important issues to promote healthy pregnancies and safe motherhood for all South Africans. So it mainly aims to educate individuals that are pregnant or
Mm-hmm.
embarking on a pregnancy about the importance of regular checkups during their pregnancies, including making good nutrition and lifestyle choices. And then also we know that early detection of potential complications and interventions or treatments do lead to better and healthier pregnancy outcomes for mothers and babies.
All right. Now, when I was reading the press release, I realized that you mentioned, or it is mentioned, that there's a new trend of delayed motherhood with women opting for later life pregnancies.
Mm.
Do we know why, or what? What are some of the factors contributing to this kind of a trend?
Yeah. Yeah, so I mean, I think in South Africa, the average age for first-time mothers still ranges mostly between the ages of 20 to 29. But
Mm.
globally and definitely in certain places in South Africa, we do see that this trend is shifting to the age range of being 30 plus. And I think, the choice of when to embark on a pregnancy is a personal decision, right?
Mm-hmm.
And there may be many factors contributing to it. But I think these days more and more women are, for example, prioritizing their education, perhaps their careers. There may be socioeconomic factors.
Mm-hmm.
People wanting to have more financial stability, for example, before starting a pregnancy. So I think there's pros and cons to having a pregnancy at any age. And yeah, ultimately, it's a very personal decision for the couple or deciding to have a pregnancy.
What are some of the risks associated with this late pregnancy tendencies or trends that are coming up?
Yeah,
Yeah.
yeah. Yeah, so I think the important thing also just to know is that, most pregnancies are still entirely healthy, most mom and baby,
Mm.
and that is for women of any age. But when a woman is age 35 and older, in the medical community, she will be referred to as being of advanced maternal age. And this is also a term I don't personally really like because I'm also of advanced maternal age.
Mm-hmm.
But I recognize the importance of this for medical reasons. So this is essentially just to alert the healthcare providers, which is usually the gynaes that will be looking after women during a pregnancy, that there is certain additional checks that should be put in place. So remember, as we get older, the risk of having other comorbid diseases, let's
Right.
say like high blood pressure or diabetes,
Mm.
being overweight, certain, these health problems are more likely to happen when you are in your later 30s or 40s than, for example, in your early 20s. So the idea would be that those conditions are also optimized or treated very early on in a pregnancy, or ideally even before a woman falls pregnant.
Mm.
There is some evidence to shows that women that are slightly older, in addition to the increased risk for having a baby with certain genetic problems like Down syndrome, there is also a slightly increased risk for a miscarriage, having a baby that is of slightly lower birth weight,
Mm. Mm.
that
Mm.
is born prematurely. But as I said right in the beginning, the importance is that everyone's pregnancy is different, and also if you have a mom, even if she is older, and even if she is in her 40s, but she's
Mm.
in generally good health,
Mm.
she can have a pregnancy that is even much healthier than someone that is in their 20s,
Sure.
but maybe not leading such a healthy lifestyle.
Dr. Smith, as you're talking now, I'm reminded of seeing some articles as I was growing up, and I think I saw this some years, like last year. Yeah, it's last year on TikTok as well.
Mm.
Could this trend also lead to a monster baby, where you find the baby is too huge or with scary facial?
Yes.
The doctor's
Yeah,
laughing at me.
so I'm not entirely sure what you're referring to, but what I can say is that women that have comorbid diseases, and often we see it in women that have uncontrolled diabetes, it can have effects also on the growth of the baby. And often if a woman has uncontrolled diabetes, it does lead to a higher birth weight in a baby.
Okay.
Of course, that is not the only reason for why a baby may have a high birth weight. Healthy, normal babies can also have higher birth weight, but big babies, we often do tend to screen a woman for diabetes, and we do see that sometimes the babies can be a bit hairier at birth. That doesn't mean that is something that would persist, after birth. There is, of course, also certain genetic conditions that can be associated with babies having a higher birth weight and having some hairiness, but. Yeah.
Yeah, when TikTok will show you things. Oh, TikTok, TikTok will
I'm
show you
sure.
things. But are there other ways of addressing these risks? Because now it's a growing trend. Women have children later on in life.
Yeah. So I think, and again, it is about having a discussion with your healthcare practitioner about ways of ensuring that you have a healthy, the healthiest pregnancy as possible, and ways of reducing risk. So, as I mentioned, would be, for example, to not fall pregnant until certain health problems have been addressed. So until your blood pressure is under control, or until your diabetes is under control, or if you are on certain medications, chronic medications, to ensure that those are safe to fall pregnant on. In terms of risks for genetic conditions like Down syndrome, there's not really much that we can do to reduce that risk when falling pregnant or in a pregnancy. There's no medicine we can take or precautionary measures that we can put in place. But I think it is just about, again, being aware of risks. And those risks are often not as high as what people may think. So, for example, at the age of 40, the risk of a woman to have a baby with Down syndrome is on average about a 1 in 85 or 1 in 100 chance. So let's say about a 1% chance. So there's still a 99% chance of having a healthy baby, but we're comparing it with, for example, the risk when a woman is 20, where that same risk is about 1 in 1,500. So, compared to a younger woman, those risks are higher, but the absolute risk is probably not as high as what most people would imagine it to be.
All right, family, I'm talking to my tongue gets tongue-tied. Geneticist, yes. I'm talking to a clinical geneticist, Dr. Liani Smit. And yes, you can ask your questions based on what we are talking about. We are talking based on the Pregnancy Awareness Week and raising awareness on prenatal care and non-invasive prenatal care. And a family member writes in, let me greet this one first and then go to you, my family. Mpoza Mhlola, hello to you, saying, I am listening. Thank you so much, my queen, for listening. Or is it your emergency, excellency? So, I don't know if it's a woman, if it's a man, but yeah, thank you, Mpoza, for tuning in. And a family member says, my son is Down syndrome and I had him when I was 30. Could that been the reason why I had a child with Down syndrome, Dr. Smit?
So as I mentioned, maybe I didn't mention it, having a baby with Down syndrome can happen to someone at any age. So we see that those risks do increase as a woman gets older. We usually only start really taking note of increased risks from that age of 35 onwards. So at the age of 30, one wouldn't be considered advanced maternal age yet. But as I mentioned, even if you are 20, there's still a risk of having a baby with Down syndrome. It's a much lower risk than when you're older, but there is still a risk. So, so for this happening with this lady at the age of 30, it didn't have anything to do with her age. It was just an out of the blue event that her baby had Down syndrome, and it could have happened to anyone.
Another one. Hello, Cookie. My Gweningen, and she says, blessed good morning, my beautiful queen and Dr. Smit. Quick question. My youngest daughter is 29. She just found out she's with child. Is it okay for her to, but I'm not quite sure, but it says, but vitamins over the counter? I think to buy vitamins over the counter, or should she first consult the doctors as to which is the best for her? Thank you. At times, the community clinic, or at times, the community clinic took care of everything immediately. Oh, in our times. Yeah, the community clinic did it all, but now
Yes,
things have changed. So, should she get
yes,
over the counter? Is it okay? Or should she consult, get the relevant, the
yes.
right ones for her?
Yeah, so I think best would always be to check with the clinic or with your gynecologist or your GP which vitamins they would recommend. But generally, if you were to have a discussion with the pharmacist, tell them that you are pregnant, they would be able to advise on a vitamin that is safe. We usually advise that women take vitamins that contain folic acid. Folic acid, we know, reduces the risk of certain birth defects, specifically neural tube defects, which is essentially when there's a problem with either the baby's spine or the brain not entirely closing very early in development. So folic acid is a way of preventing those birth defects.
Swangile, a friend of mine has a child and they told her they are still researching and finding out what is the problem. He hasn't been diagnosed, but they say it's genetics. How is that possible, Dr. Smith?
Mm. Yeah, so obviously there are many possible genetic conditions and syndromes out there, over 8,000, and we are still counting. And most of
What?
these, yes, and most of these conditions are individually rare, meaning that there's not many people necessarily with that specific genetic condition, but
Hypo.
overall, they may be common. So, so depending on who the doctor is who is seeing this patient's friend's child, it depends on how far that child has been assessed and what kind of genetic tests have been done. There's not one genetic test that can test for everything at this point in time. There are certain centers in South Africa where there are genetic specialists or medical geneticists or clinical geneticists. So it may be worthwhile asking to be referred to one of those specialists if you are feeling that you're not getting the answers that you need.
All right. Hi, Frank Jacobs. Hello, hello, hello. And he says, great show. Thank you. And greeting you. Frank Jacobs is greeting you, my queen. Dr. Smit, Frank Jacobs says hello to you. Herodias Tivedi saying good morning, Gugazi. Thank you so much, Herodias. And Mpo is asking a question. Mpoza says, the medication people take for falling pregnant easily, is it not also affecting them? Can it affect the pregnancy?
Yeah, so again, I'm not entirely sure what medication she is referring to.
Okay.
So I think it would depend on what is being prescribed. Is it just vitamins or is it specific medication that is perhaps inducing ovulation? So best would be to have a discussion with the doctor that is prescribing it and double check with that doctor that it is entirely safe to take that medication while trying to fall pregnant.
Okay. Spongile, please ask the doctor when is the right time to do the NI something.
The NIPT.
Woo! Yes.
So when you have your first visit with the doctor when you are pregnant, and that is another important factor, right? As soon as you find out you are pregnant,
Mm.
you go and book your pregnancy, whether that's with your gynecologist or at your community health clinic.
Mm.
The sooner the better. So currently NIPT is not available in the state or government sector. It is only available in private practice, so
Okay.
through your gynecologist.
Mm.
And they would usually discuss the options of testing with you. So the NIPT test can be offered from as early as 9 weeks into your pregnancy.
Ah,
So
okay.
that's incredibly early. There's no cutoff point. It can be requested even after that. But the main benefit is that you can already get information about the health of your baby so early in the pregnancy.
Is it precise?
The test.
Mm-hmm.
Yes, so it is. So it's
No
considered
mistakes.
so it is what we call a screening test, okay, meaning that it is not 100% accurate or diagnostic. Okay? It is the most accurate screening test.
Mm.
It can detect Down syndrome with about 95% accuracy,
Oh.
but it is possible that false positive results may occur. So when you do this NIPT test, it will never tell you, yes, the baby has, it will never say positive, yes, the baby has Down syndrome, or negative, the baby does not. It will only indicate a risk and say high risk or low risk. If your result says it is high risk, there will be a 95% chance that it is a correct result.
I think,
And
and?
yeah. No, and usually, and then that would then influence the decision for most people whether they want to have an amniocentesis test to essentially confirm the diagnosis or not.
I think Dr. Smith should just explain to the family the role the non-invasive
Exactly.
prenatal testing plays in ensuring the health and the well-being of both the mother and the
Yes.
baby. Yeah.
Yes, that is very important. So there is a consenting process that goes with it. So it is not just a test that someone can just go to the pharmacy or go to the laboratory and have the test. It is a test that has to go through their healthcare provider.
Okay. So it how the role it plays in making sure and ensuring the health of the well-being, the health and well-being of the mother and the baby.
The role of the test.
Mm-hmm, mm-hmm.
Yes. So if the test indicates that the baby has a high risk for a certain genetic condition,
Yes.
that allows both the doctor and the family to obviously, it gives them more information about their baby's health. So, that's information that may or may not influence further decisions or screening tests, or, for example, the decision to have an amniocentesis in the pregnancy. Some families may choose, let's just wait until the baby is born, and then we'll do further tests if necessary. But we know that if a baby has Down syndrome, about 40% of babies with Down syndrome are also born with a heart defect. Some babies may also be born with, for example, a problem with their gut, where the intestines are blocked. We call it an atresia. So that can be important information that one may want to know already if that is present in a pregnancy, because it affects the immediate management of the baby after delivery. So, for example, if you now know that the baby may have these complications, the pediatrician or the doctor attending the birth of your baby also know what immediate measures to put in place, so there's no surprises in following the birth. So it really puts both parents and the healthcare providers in a position of making more informed decisions and being more empowered about the pregnancy and about the health of the baby.
So when it comes to genetics, because it's you're checking genetics and all that, but you can correct me, there is no way of helping the child while still in the womb after discovery, or is there? Because I know with the heart, there are operations that can be done if there's something wrong with the ventricles or whatever that you say, and you can operate the child whilst they are in the mother's womb. So when it comes to genetics, there's no way. So we'll see after the birth.
Yeah, so at the moment, there is still no way that we can cure chromosomal genetic conditions like Down syndrome. There is a lot of work and research being done into cures for genetic conditions. For example, Duchenne muscle dystrophy is one of them. But
My
as
son is
you know,
diagnosed with that.
oh, really?
Yes, and
Yeah.
autism. So I know what you're talking about.
Yes.
Yeah.
Yeah. So that must have been quite a journey for you as well, to
17
complete.
years of a long journey. Yeah.
So so as you know, there's no cure, for these conditions. Unfortunately, they are still permanent, but that doesn't mean that there's nothing that can be done. So there's still very much options for treatment and early intervention. And we know with anything that early intervention and preventative measures improve outcomes further down the line.
Now, tell us about how Mediclinic Precise Panorama and IPT differentiate itself from other prenatal testing methods, and
Yes.
what are its key advantages?
Yes. So, I think we've covered quite a few of
A
those.
few,
So I guess
yeah.
the main benefit is that it is non-invasive, that there is no risk for miscarriage in the unborn baby, that it can be done so early in pregnancy at 9 weeks already, and that it is currently, in terms of screening test, yes, we said it is not diagnostic. Cannot give you 100% accurate result, but when it comes to screening tests, other screening tests are other blood tests that may be done in the pregnancies, ultrasounds, etc. It is actually the most accurate screening test for genetic conditions like Down syndrome in pregnancy. It can then also detect a range of the common genetic chromosomal conditions. And one of the main advantages of the Panorama test, which is a specific type of NIPT test that is being offered by Mediclinic Precise, is that it can differentiate the DNA that is coming from the mum. So remember, if you take the blood from the mother, there is DNA from her own blood that is in that sample, but there's also DNA that is coming from the pregnancy that is in that sample. And what the Panorama test does is it can actually differentiate what DNA is from the mum and what DNA is from the baby. So it gives you more accurate results. It also means that if a woman is pregnant with twins, especially non-identical twins, where the twins would have different DNA profiles, it can also detect and differentiate what DNA is coming from which twin. So it can tell you the sex of the twins individually, and it can also tell you if
Amazing.
if the one twin, for example, is affected with a genetic condition or not. So yes, so it is, and yeah, maybe I didn't mention that, but the NIPT test can also tell you, just for any pregnancy, also what the sex of the baby is, if you want to know that.
As
Obviously,
early
that's not
as 9.
at 9 weeks. Obviously, that's not the main reason it was
Okay.
developed, and
All
not the
right.
main reason why people should have the test. But it is one of the
Advantages.
advantages of also having an NIPT test.
Okay, a family member says, Bongile, can it also say if the children will be conjoined?
No. So conjoined twins are essentially identical twins that just didn't separate completely in the womb shortly after fertilization. So for conjoined twins, that would be identified on an ultrasound. So as I mentioned, the NIPT test is good for detecting genetic abnormalities, or specifically chromosomal abnormalities, but it cannot detect structural abnormalities, so physical things. And often the two goes together, right? So often, as with Down syndrome, there might be a heart defect, but the NIPT test cannot tell you, okay, the baby has Down syndrome plus a heart defect. You would still need the ultrasound to detect the heart
that.
defect. Yeah.
All right. Cookie says, also wanted to say one of my grandsons was born a normal health 3.2 kg baby. When he was 3 years, he was diagnosed with Kawasaki blood disease. He recovered fully by God's grace. All the side effects that doctors said would happen and would not be bearable to look at did not manifest by God's healing power and grace. He is now 9 years old. All tests are negative. He is well, only not sure where and how did this happen. So, Kawasaki blood disease, Dr. Smit?
So, is it Kawasaki?
Maybe. Cookie said Kawasaki, so I assume it can be
Kawasaki.
Kawasaki. Is
Yeah,
Kawasaki a blood disease?
yeah,
Okay.
Kawasaki is a heart condition where the immune system essentially attacks the blood vessels in the body, but it's not a genetic condition. There can be some genetic risk factors. And people don't necessarily exactly know what causes it, but it seems to be more of what we call an autoimmune condition. So I'm really thankful that he's made a full recovery and that he's
Yes.
currently in good health.
Yeah, she says, yes, it is. Kawasaki, it is.
Yes.
Lita wants to know, I hear a lot about stem cell replacement when it comes to genetic
Yes.
disabilities. How good is this treatment? Dr. Smit,
Yes.
you are in the spotlight today, so
I'm very impressed by how informed your listeners are, Sibongile. Yeah. So, no, stem cell replacement and research is a very exciting part of treatment for many genetic conditions, especially genetic conditions affecting the immune system and the blood system. So, so essentially what they would do with stem cell replacement is that you would look at replacing the individual's stem cells or their DNA profile essentially with another profile that does not have that same genetic condition or disease as what you have. It does offer success. It is not an easy process. It is extremely complicated. There's lots of risks involved because the patients need to go through immune suppression. So you first have to suppress your own immune system, and then there's risk for infection. So it is exciting. It is possible. Not for all genetic conditions, but for a certain number of them. Yeah.
Wow. All right. Now, Dr. Lindsay Peterson in the press release mentions that collaboration between Mediclinic Precise and the patient's doctors he talks about that providing expert guidance on genetic reports. Can you please elaborate a little bit how this collaboration works and its benefits?
Yes, so the patient will never be requesting this testing themselves. So it will always go through their healthcare provider. And we are in constant communication with healthcare providers. And I also just want to emphasize that this test is not only just available to Mediclinic doctors. It is available to any doctor or healthcare provider. And we would support any healthcare providers, not just those that are affiliated with Mediclinic. So essentially, Dr. Peterson and I are both available to the doctor. We will support them through the test requesting process. When the report is released, we will also offer them guidance in terms of the interpretation of the result, how to communicate this to the patient or the family, especially if there's something maybe unusual or something very rare that is being detected on the test. And then furthermore, what we do offer as part of Mediclinic Precise is that we do offer genetic counseling to the patient or to the individual who's had the test if they have a high-risk result. So if you've had the test through your doctor with Mediclinic Precise and you have a high-risk result, one of our genetic counselors will have an informative session with you where you will have the opportunity to get as much information as possible about the result, about what the implications are, and about what the next steps would be for you.
Wow. My queen, thank you so much for talking to us this morning. We have learned quite a lot. I'm hoping that you're not just coming in today, you'll come back again.
I'll be happy to. Thank you so much for having me. I
Yeah,
really enjoyed it.
so for us who'd like to know more, how do we get in touch with the Mediclinic Precise?
So Mediclinic Precise has a website, and so you can just have a look at mediclinic.co.za and be led to Precise. You will find all of our tests available there. You can also, if you want to find out more specifically about the NIPT test, you can email Mediclinic Precise at now I must just think.
But if we go to the website, that's where we can
It's
get.
the website, yes.
Yeah, no,
Thank
thank
you.
you. Thank you so, so much, my queen. Have yourself a beautiful one. And really, hopefully, we'll be talking to you again. We had such an awesome session with you right now. We have learned quite a lot. Have a great day further.
Thank you. You too.
Wow, family. Bye. Wow, family. That is Dr. Liani Smit, who is a clinical geneticist. And wow, we have learned a lot. We have learned quite a lot. Do remember that you can go to their website, Mediclinic Precise, and you can talk to them right there. Find out more right there in the awareness of the Pregnancy Awareness Week. And I believe that in our public clinics, you can get more information right there. I believe there's so much education that's taking place in our clinics. So you can just drop in and ask questions and get help in what you are going through in your pregnancy. I need it.